We spoke before she introduced her topic to me, and she was actually inspired by one of our esteemed speakers and instructors of our ERAD content that really goes deep into cardiopulmonary function, kidney function, that our moms are struggling with, preeclampsia, all those things that we want to avoid. And that was Dr. Katherine Sylvester, who presented for us in March. And so our main speaker, Mary Beth Thompson, was inspired by that talk. If you have not gotten a chance to see it, that was a talk that really dealt with protecting our patients' hearts before, during, and after delivery. And that is on the ERAD website as its own standalone webinar. I recommend it to everyone who's not familiar with all the vital sign testing, heart rate monitoring, all the things that we could be doing during pregnancy, even during delivery, if we're practicing as doulas, and then especially after, during the first 24 to 48 hours after birth. We can be doing so much more with this population in terms of protecting their response to activity. And Dr. Sylvester went into amazing detail. And so that brought up Mary Beth Thompson's talk tonight called The Mom Matters. And she was inspired by the Mom Matters is a phrase that Dr. Sylvester used in her talk. She has worked in a variety of settings, including acute rehab, focusing on neurological conditions, outpatient orthopedics, home health, and acute hospital care, and has had over 25 years at Innova Alexandria Hospital. And so she provides there general and neurological physical therapy, breast cancer rehabilitation, pelvic floor rehabilitation. She treats both adult women and men for pelvic floor issues. And she has special interests that include pregnancy and postpartum, pelvic pain conditions, GI conditions, endometriosis, prolapse, IC, incontinence, neurological diagnoses, and oncology. She is an APTA clinical instructor, a Herman and Wallace teaching assistant, and she's received the Pelvic Rehabilitation Practitioner certification through the Herman and Wallace Institute. Without further ado, I will invite Mary Beth up to the stage, and thank you so much for being here.
Thank you. Thank you. Are you able to hear me now?
Perfectly.
As Dr. Sylvester said, the Mom Matters, it kind of made a light bulb go off. What does that mean to different people? So I kind of did my talk. I was kind of thinking about my talk about how the mom matters to different populations and different instances. And then I came to how does the mom matters in legislative. Now, I live in Alexandria, Virginia. I've lived here for longer than I've lived in New York, which I still consider myself a New Yorker. But I literally can get on my bike here and be down at Capitol Hill within an hour if I go fast. So I'm so close to the nation's capital. And when you're so close to the nation's capital, and you, even if you're not working in the government or legislative, you know someone who does. So I started researching what kind of policy is out there regarding the Mom Matters. My daughter is actually a junior or third year at University of Virginia, and she's majoring in foreign affairs and public policy. And she was very interested in environmental science. But she said, really, and I said, well, why instead of going into science, do you want to do like government stuff? And she says, well, really, if you want to make changes, you got to do it with policy. And so that's what my daughter's doing. So the point that I'm going to, let me get to the next slide. Let's talk about what actually is policy. So policy is basically what connects people with programs and services. Government serves as a facilitator for these activities. And so then the goal of health policy is to basically promote the health of individuals and within the community. So I just wanted to give an overview of what we're talking about when we talk about policy. And so modern health policy does have a lot of legal, ethical, social issues that we may see in the other slides. So the bill, the Maternal Care Act, was introduced in April 2021 by Senator Kirsten Gillibrand. And it's to support states in their work to end preventable morbidity and mortality in maternal care by using evidence-based quality improvements to protect the health of mothers during pregnancy, childbirth, and in the postpartum period, and to reduce neonatal and infant mortality, to eliminate racial disparities in maternal health outcomes, and for other purposes. Now, that bill died January 3rd, 2023. If nobody's angry, I'd be very worried right now. It seems like it's so practical what she's putting forth. It's so basic what she's putting forth. And why did it get killed? And I tried looking around and I really couldn't find anything, but I'll get into that in the next two slides. My next one was basically, you Google the Mom Matters, and here's where you get a piece of legislative that actually says that. Moms Matter Act. It was introduced by Representative Lisa Blunt Rochester in February of 2021, and it died on the same day as the other bill. This bill was establishing 2 grant programs to address maternal mental health conditions and substance abuse disorders with a focus on racial and ethnic minority groups. So next slide. So now we're talking about why did this legislative die? They seem both very beneficial to more than half the population in this United States. So then we get into major issues with legislative policymaking. So the first one is that, we have on the Hill, we have the differences. The Democrats and the Republicans, they don't want to kind of work together. Each has their own agendas, et cetera, et cetera. They seem to vote along party lines rather than what they believe is good for them. There's also the legislators may be indebted to particular individuals or groups that help them to get elected. And they're also highly sensitive to well-organized interest groups. Now, that doesn't mean that, if the American Medical Association raises a ruckus about things, then they may listen. So if the National Chiropractors Association raises a ruckus that they don't want, as far as physical therapists to have direct access, etc. There's 2 states in the country that do not allow dry needling. Special interest group right there is acupuncturists, etc., etc. Then the last one is legislators are frequently operate on a limited horizon. So when they're voted in, basically the clock is ticking to when they either try to run for re-election or they're voted out of office. So they only have a short period of time to try to make some changes. So when they introduce these bills, by the time they may go through and get approved, that person who introduced the bill may no longer be in Congress. So there's those issues right there. So let's go to the next one. Okay, so now we're coming into good news. April of 2022 is what Rebecca was talking about. The Health and Human Services announced approximately $16 million to strengthen maternal, infant, and early childhood home visiting programs. And those wards will advance data and technology, support positive maternal and child health outcomes, and focusing on health disparities. So it just goes on a little bit about the quotes about why they brought forth that. So I think what we're seeing is that the programs and the money and the funding and the policy doesn't necessarily seem to come from Congress and bills itself, but other government departments, such as the Health and Human Services, et cetera, et cetera. So there's another one right here in Health and Human Services again, May 2022, announced the launch of a federally funded, remember here we are, federally funded maternal mental health hotline. And moms can call this number. In the past year, they received over 12,000 calls and texts in their first year. So I think that so is very, I think that that's very significant. For, I remember, you know, if I probably had this when I had my kids, I would have called them at some point or another. And it's okay to ask for help. Basically, I think that's the bottom line here that it shows. So we have, let me just see, here we go. Okay, so now we have a bill. Now this is fast track here. Bill that was introduced in May of 2022, and it passed in June of 2022. And so this bill is Restoring Hope for Mental Health and Wellbeing Act. And it will provide funding and support of mental health screening. So you see how both the funding on the Hill and the Health and Human Services, how they kind of work together to promote these programs to benefit our mothers. And so basically, one of the quotes that they said is basically the best way to take care of the children of the future is to take care of the mother. And that goes back to Katherine's statement that the mom matters. Okay, and sorry, my thing is, okay. So now the policy center. So then I started to look at different, a little bit outside other organizations, lobbying groups, kind of nonprofits, if you will, that support all these initiatives and really work behind the scenes to get this kind of information known to the legislative and the proper departments. So there's, this one was really good, is the Policy Center for Maternal Mental Health. Fabulous website, highly recommend it. They're dedicated to closing gaps in maternal mental health, to produce tools, resources specifically for hospitals and health systems to improve maternal mental health. So these just gives a couple of things where what their policy center is, and how they tend to kind of work together for the mother and the daughter. or the mother and the children, I should say. So how the different groups such as hospital and health systems, the lawmakers, party payers, and also nonprofits can all work together to kind of work to a common initiative. So the next one. So we were talking about, how even after C-section, that these mothers don't go for their follow-up for 6 weeks. As Katherine was saying in the cardiopulmonary stuff, that a lot of, I think I read somewhere about 52% of most deaths that may occur postpartum occur within the 6 week, correct me if I'm wrong, in the 6 week period afterwards. So the American the ACOG committee brought forth an opinion, the Presidential Task Force on Redefining the Postpartum Visit. Their recommendations, and this was reaffirmed in 2021. So this was after COVID happened 2 years ago, and that it says all women should ideally have contact with a maternal health provider within the first 3 weeks postpartum, especially if anybody has any complications such as preterm birth, gestational diabetes, hypertensive disorders. They should actually check in a little bit more frequently or earlier. So according to the ACOG, optimizing care and support of postpartum families will require policy changes. Changes in the scope of postpartum care should be facilitated by reimbursement policies that support postpartum care as an ongoing process rather than an isolated visit. So I think that's pretty significant right there, that the doctors are talking that that mothers should be seen earlier than 6 weeks, which has been our norm forever and ever. And now 2 years ago, they were saying that they need to be seen or really contacted, followed up in some way or form in 3 weeks after. So I'm not sure in your area whether that your mothers are being checked in with by their gyne teams, their midwives, and being checked in at 3 weeks, or if it's still 6 weeks. So then there's other resources that we have that I found. I would highly recommend reading First-Time Mothers' Perceptions of Social Support, Recommendations for Best Practices. That was a very, very good article that kind of brought together a lot of things that I was talking about. There's also something called the Maternal Mental Health Leadership Alliance. And then there's another group that's called Mom Congress. These people actually converge on Capitol Hill every year. It's a policy organization for moms in the United States. It's a mother's membership organization that addresses a lot of policy issues of motherhood. So that pretty much wraps up my talk.
Gail has her hand raised. Gail, feel free to unmute and join in this conversation.
Hey, thank you. The one bill that wasn't covered, interesting enough, is actually one that's written by a team of physical therapists and your colleague. So this year it's House Bill 2480, and you were a little bit curious about the funding and why it goes that way. So sorry, I was just doing yard work. So trying to turn on my camera, but it's not working. All right. Anyhow, this bill, we, as physical therapists, we want to take in the whole world. And then we got into the legislative process and we learned a lot. And so what we really wanted was the ideal. We wanted all of our services to be covered for everyone. And they said, okay, well, which federal entities cover maternity? Like, does Medicare cover it? Well, yeah, so Medicare really doesn't, there's not a whole lot of geriatric folks on Medicare that are having babies. And so they said, then we were like, well, how about Medicaid? And how about the federal payers? So that's why you see them turning to studies with HHS and so forth. So they did allow us, in ours, it's 3 prongs, and 1 prong is actually a study for, what is it, $2 billion in funding to fund physical therapy research for a 2-year period to determine if physical therapy during the perinatal period, if it is effective. So I encourage all of us to kind of put our heads together and figure out how can we measure these things, because I am really hoping this gets passed this year and that there's people either on this call or someone we know that'd be willing to do that research and help support all of us. Even if you haven't ever been a researcher, still just kind of think that way. And so far, we have a very good shot because one of the chairs of one of the divisions signed on to the bill as a co-sponsor. So APTA is going to be asking for folks to, if you're interested in joining the task force, to join. The call will be going out in about a month, and we'd love for anyone that's interested to volunteer.
Gail, just for the sake of, just so that the audience has heard and hears it again, can you repeat that bill? $2 billion for 2 years to study the benefits of physical therapy for this population.
During perinatal, so it would be anywhere during pregnancy to postpartum, and we got in the partial WHO wordage of through lactation. So if someone lactates for 2 years, it would cover them for that 2-year period. One of our concerns is that many of the payers, particularly Medicaid, only pays for 3 months postpartum. And the problem is a lot of those mamas you don't see day 1, and they come at week 11, and you're like, great, I can see you for a visit, and then you have no funding. And so we're really hoping this will impact those Medicaid patients. There is a component of education too. And so we would love to, work with HHS and the powers that be to get that education piece, because y'all know, you're the choir, no one knows about pelvic health therapy and what we do. And then when they do find out about us, we're the game changer. So we would love to have more of that.
Excellent. Excellent. Thank you so much. And where can they find this information? Where is it just wait for APTA to give more information?
So there is actually a form letter. I believe it's already up, that is on APTA's app, and you could go ahead and send your representatives. If you're already in there, it takes under 60 seconds. It's really fast. The other great thing is you could even open it up on the patient facing side and have all your patients send letters too. The more the merrier, because the more co-sponsors means we're going to move forward, and we would love that.
That's awesome. Gail, thank you so much for your time. Thank you.
Yeah.
Thank you so much.
You're so welcome. Thank y'all for the talk tonight. I just, going the policy route is important, and also just doing the work in the community and making sure that moms know what they have access to, what they have rights to is super important as well, because sometimes it takes a long time for policies to change, So it's really encouraging to hear all this money that's being given away. But today, gosh, I was just heartbroken. And I think I want to tell you one other short story. There's a lady who reached out to me after 3 years of being in a wheelchair. She had a severe pubic symphysis diastasis that was missed, and her husband heard about. He was Googling and ended up finding us, and ended up getting her connected with a physical therapist in North Carolina where she lives. And it took a while, but she's back to walking some and everything. But you think about it, 3 years of your life where you don't have the care that you need. Even if we took away the emotional stress of that, what it is for a mom to not be able to care for her baby, all of those things, think about the cardiovascular impact of you not walking for 3 years, not working, not doing the things that we're supposed to be doing. these women's quality of life, their length of life, I would argue, is impacted when things like this are missed. And so with this lady, her dad is actually going to get her referred to a physical therapist because he was in there for his neuropathy. I was just shadowing because, I love to learn. So I was learning about thyroid and the pancreas and the changes that take place during pregnancy, and then just the newer treatments and devices and all the things that are out to track, because some of our moms have the Dexcom, so I can see their glucose minute by minute. Is so amazing and such good feedback for them in their decision making. But anyway, he has had diabetes for 40 years and has no issues. He walks 6 to 8 miles a day. He works, like his hemoglobin A1C is actually really good. But he brought up his daughter, and he was like, my daughter, after she had her baby, just all of a sudden, it was 2006, she had her baby. And he's just telling me this today. And so she lost 2 toes over the last couple of months. And when she had her baby, they told her that she had diabetes, sent her to an endocrinologist. So the endocrinologist has just been following her. But he was told today that she lost 2 toes. And they said that it was, after the pregnancy, she just was diagnosed with diabetes and there was no other follow-up. So even though her feet were numb, her legs were numb, she was having difficulty walking, they said that it was the neuropathy from diabetes. And that's all they said. So she was never educated about foot care or, wasn't tested for things that we would do, like teaching them how to check their feet and, but also realizing that the only reason that you lose sensation is not diabetes, right? Like figuring out what was it. You don't have a baby and then lose sensation all of a sudden. That's not normal. And so anyway, she's going to go to a pelvic health PT. She's going to go to a neurologist. They're going to get to the bottom of it, because at the end of the day, the endocrinologist that I see and me, after we talked, and the father were just like, this doesn't sound like diabetes at all. It sounds like a nerve injury, right? And so we just have to get her diagnosed properly and then get the right people on her team so that she doesn't have further damage for no reason.
So you did mention in the chat, because that's maternal. That's what we would term maternal morbidity, short and long-term consequences as a result of pregnancy. We're not taught these terms in school, Dr. Sylvester. So people, when they hear that, they are not going back even in our history taking, to what was your pregnancy like? What was going on? What position did you deliver in? What medication, what interventions, what all of the things, right? And so we see them way later on as pelvic health therapists. That's great. But what in your chat, it like really just made me curious. What would you have expected an acute care therapist to have caught?
Girl, like this is the ones who go through ERAD and really just people who know neuro, who I would have expected them to ask those questions, like you said, how long was your labor? How long was the baby? How long is the second stage of labor? How long did you push? In terms of the sensation loss, they could have just tracked that back to a peripheral nerve. Like we know how to track nerve loss, sensation loss, pain. I feel like we could have caught that and then got a neurology consult right away. And if it was diabetes, it could have been, they ruled everything out and that's what it was. But the sensation loss would not have been ignored, is how I feel. And that was 2006.
Mm-hmm. And so when I hear that, and I get like excited, like when Gail comes on and she talks about the policies, and I just see these amazing therapists who are on the front line and trying to change policies. I also am just like, my heart is breaking, for moms who are still waiting, who are still having impairments. And just, we had one recently, that you and I, Dr. Sylvester, worked with, just to have a mom that was sent home to a multi-level home who could not go up and down her own steps. So my question to you is, we don't have the funding now. We don't have the $2 billion now to train and completely transform graduate school so that OTs and PTs are just taught about this population like they would be any other population. Like that just seems like a stretch for whatever reason. What is the education that we can at least be at least imparting to therapists now. And that's why I'm going to bring up this, because you did speak on this. I mentioned it and I was trying forever to locate the flyer for it. But in this education, you give a snippet of just even what you explained tonight about what therapists should know so that we're protecting these patients before they go home. Can you just give a little bit about what you discussed in this course, this webinar?
Yeah, so this was really about all the changes that take place to the body, the heart, the kidneys, the lungs, just the stress that a woman's body is placed under when she gets pregnant. We think about, I think it's what y'all said earlier, you can see something like a C-section scar, but really thinking about how high does the heart rate get? What is the normal trajectory of HRV, of stress, of the heart rate, of blood pressure, of sugar, like people realizing that the body retains sugar in the bloodstream so that the baby can have access to it. Well, what about that mom that goes into pregnancy with the hemoglobin A1C of 8? Right? She's already not managing sugars well. They need to know that. Moms need to know that. And then they also need to know how walking can help with that, right? Like we have the tools, we know how to help with these things, but we have to know how the body's changing during pregnancy in order to give the best advice, not only during pregnancy, but helping them show up to pregnancy. People come to us and they're not pregnant, but they're of childbearing age, right? And so we need to make sure that their entire system is prepared for everything it's going to have to withstand: liver, lungs, pancreas, all of it. And so we talk about specifically the heart, the kidneys in this talk.
Right. Excellent. Excellent. Thank you. Thank you. Thank you so much for your time.
You're welcome. Thank you.
So I had a thought to share about the bill that Gail talked about. And then of course, Dr. Sylvester made me think of even more things, because that's always what happens when she talks, because she has such a wealth of information and just like expertise. But my first thought about the bill was, so one of the things I do in my community is I teach a free pelvic postpartum class for a local nonprofit doula organization that provides free doula services to low income members of our community. And I let them know that pelvic health is a thing that exists and that outpatient therapy is a thing that exists, and for a whole host of issues you could run into postpartum, right? You don't just have to live with peeing your pants, all of that kind of education. But one of the most common questions I get from them is, well, how much does it cost to go to outpatient pelvic PT? Are there providers that provide it free, or like a clinic or a low income clinic I can go to? Or does Medicaid of pregnancy cover it? Which, like Gail was saying, Medicaid of pregnancy doesn't cover a ton, and it's over a very limited period of time. So being able to expand the services that Medicaid can provide to those patients would be a game changer for a lot of them, because a lot of them, they're like, oh, wow, I didn't know this was a thing I could, ever treat postpartum, but, well, I'll never be able to access that because of my, social determinants of health that, or my, and the income issues that I'm going to have with accessing that, even though I live in a major city. So, for me, that's just not a possibility. And that's something that's really only going to change on a policy level, right? If the access they can have can change. And then one of the things that Dr. Sylvester made me think about when she described that lady that had been in a wheelchair, I saw that lady. I mean, obviously not that exact lady, but I saw that lady in acute care. I have seen her, and they were going to discharge her that day. And one of her nurses was like, this lady's still in a wheelchair. Like, she can't even get to the bathroom, and got PT to come in. And I went and saw her, and yeah, she had a pubic symphysis separation that was pretty significant. And she's in tears because she's like, how am I going to go home and take care of a baby? I'm in a wheelchair. Like, I can't even stand up and walk a couple steps. And all it took was putting a support belt on her in the right place and the right level of snugness. And she was able to stand up and walk. And we walked out into the unit together, and like, her nurse was crying. She was crying. She's like, I thought I wasn't going to be able to walk. And they were going to send her home. She was going to be that lady that Dr. Sylvester saw that hasn't walked in years, because they were just going to send her home in a wheelchair. And it took an acute care therapist, 10 minutes to get her up and walking. And it changed her life. That was a really simple intervention.
Amazing.
Right? I didn't need a lot of complex knowledge. And she's also totally right that like we can map dermatomes and do sensation testing. And we also know that diabetes doesn't cause neuropathy that makes your whole leg numb in a couple months. Like we know that that's not the normal course of diabetes as acute care therapists with no pelvic training. So that's a flag that we could catch. And there are just flags like that all over the place that we can catch because of our neuro training, our cardiopulmonary training, right? We can our orthopedic training. There's so much that we can catch even without a ton of pelvic knowledge. And then if you add the pelvic knowledge on top that people can get from taking the classes the Pelvic Health Network offers, I mean, it's game changing.
Yeah.
What you could do for these people.
I think it's pretty clear. We can't afford to work in silos as organizations, as therapists. Mary Beth, I mean, you made that really clear in terms of just the policies that have been, you know, either passed or just dead, you know, dead on arrival. Like we can't afford to sit on the sidelines and allow that to keep happening. Do you have any parting words in terms of like just, you know, kind of a call to action that you want people in the room who stay tonight, who are viewing this later, that you want them to do in order to no longer sit on the sidelines? Anything, Mary Beth?
No, I think, you know, it is, policy is important to make changes, but, you know, that's the whole point of having the APTA is they're like our lobbying efforts and everything. So we don't have to go it alone. We have to work together. And so see what other resources are out there and what else we can do to help all the moms and make the moms matter.
Thank you so much. Thank you so much for your time tonight. And what a wonderful presentation. Can't thank you enough.
Thank you.